Hello?
Good morning, everyone. My name is Erin Flynn, and I'm the ACO and Practice Transformation Director at the Department of Vermont Health Access. It's my pleasure to welcome you all back to the webinar series offered as part of the Vermont Healthcare Innovation Project's Core Competency Training. In today's webinar, we will explore the topic of sexuality and reproductive health of individuals with disabilities. Before we begin, I would like to cover a couple of brief logistical points. On this slide, you will see a screenshot of the webinar control panel. You each have one of these, and this is your tool for participation in today's webinar. Under the header Audio in your control panel, you will see two options, telephone and mic and speakers. By default, the webinar will connect to your computer's audio. If you would like to change this, please click on the telephone button and you will be provided with call-in information. Next slide, please. All participants are muted in order to optimize sound quality for the duration of today's webinar. We hope to have an engaging dialogue with our presenters and have reserved time for Q&A at various points in the agenda. We encourage you all to pose questions using the chat box in your webinar control panel. I also want to notify participants that this webinar is being recorded and will be made available for future training purposes. Next slide, please. So, as I mentioned, we'll pause throughout today's presentation for a moderated Q&A session at 12:30 and then again at 12:55. So please type those questions in the question panel as they come up. Great. So now I would like to introduce you all to our team of presenters from the Green Mountain Self Advocates. First we have Max Barrows, our Outreach Director from Green Mountain Self Advocates. Also with us is Nicole LeBlanc, the Advocacy Director, Karen Topper, Administrative Director, and Karen Noon, a consultant with Green Mountain Self Advocates. So with that, I'd like to hand it over to GMSA to begin their portion of the presentation.
Hello, everyone.
Hello. Good afternoon.
Want to just say who you are so they can recognize you?
Hello, this is Nicole LeBlanc. I am going to go over today's learning objectives. Number 1, recognize barriers faced by people with disabilities when accessing reproductive health care. Number 2, identify tools that adapt medical information to be cognitively accessible, including adopting a values-neutral posture. Recognize and respond to the personal and cultural barriers that many people with disabilities experience when attempting to end or report sexual violence. And number 4, understand the experience of parenting with a disability.
Next slide, please. So my name is Karen Topper. Welcome, everyone. So I'm going to begin today by asking Max Barrows and Nicole LeBlanc, two of the self-advocates who work here for Green Mountain Self-Advocates, who is considered sexual? So if you think about all the messages you've received growing up from the media, at school, from your family, who is considered sexual?
Good question. When we look at the media in today's world, sexual is defined as looking skinny, physically fit. We are basically brainwashed to believe sexy is a thin Barbie doll, like woman's body type.
Well, that's a good question. What we came up with for who is considered sexual is what I've observed through the media, and that is straight white males and females, persons without disabilities, lesbian, gay, bisexual, and transgender, medical professionals, politicians, college students, high school students, celebrities, athletes, and musicians. And this is all of what I've seen through, TV shows, music videos, and just etc., et cetera, throughout what I've observed
Humans who want power and attention use their sexual appeal to get what they want. The people that do not naturally look like the celebrities or can't afford to doll up, I guess they are not sexual, at least not by standards.
So next slide, please. So people without disabilities, as you can hear from Max and Nicole, they really dominate our culture in terms of defining what femininity is, what masculinity is, what the ideal body image is, what pregnancy is, what fatherhood is, what childbirth is. And just in preparing for this webinar, we are just seeing how kind of the attitudes of the general society really are spilling over into the healthcare settings. And we found numerous articles where people with disabilities were reporting that they kind of feel degendered in healthcare settings. In other words, their roles as women, men, lovers, spouses, mothers, fathers, really are typically ignored. So if you look at the pictures that are in the slide that you now, this is what we would like to kind of put into the mix of who is considered sexual. And so in a world where people with disabilities have equal opportunities, we really hope that, looking to the future, that and I'm looking for a more inclusive world, we're going to be able to see people with disabilities really being portrayed by the general culture as being sexy, as being sexual. Next slide, please.
The World Health Organization, otherwise known as WHO, defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. WHO defines sexuality as a central aspect of being human that encompasses more than reproduction and is influenced by biological and psychological factors, among others.
This is Karen Noon. People with disabilities have historically been considered to be asexual, oversexed, and or predatory. We know better. They are often subject to prejudices of our communities. They are undertaught and often ignored when it comes to information about sexuality. Also, many support staff are not trained when it comes to supporting people around these issues. Parents also need to have tools to answer their children's questions about sexuality.
The next slide, please.
So sometimes it is difficult to keep our opinions, beliefs, and values to ourselves, especially when they are about sexuality. But it is an important skill to have when talking with others about sexuality. The next activity helps us explore our own values so that we can manage them and keep them to ourselves.
Everyone has their own values. No one person's values are better or worse than anyone else's. Look over the values on the slide and decide where you stand. 1 is strongly agree, 2 is agree, 3 disagree, 4 strongly disagree. Take a few minutes and look these over and determine where you stand.
And we do want to add that this is a private activity, and we're not going to ask you to, send us your answers or anything like this. This is just really a time for you to kind of self-reflect and just check on your own values. We'll be coming back together in another 30 seconds.
So Topper, which was the hardest for you and why?
Well, even though I'd like to keep it private and not share it with everyone, I would like to say that I guess I got to be honest that number 8 is really one of the hardest ones for me. And why? Because you know, I've been in situations where I've provided support to parents with disabilities who were getting their needs met, and also to some that were not. And so sometimes I felt a little nervous in that position. So.
What might be behind these situations?
I think that you know, I firmly believe in the right of people with disabilities to raise their children and to get the supports they need, but sometimes the supports are not, you know, funding for the supports are not available, and so, like, I just repeating myself, I think I just at times have been kind of nervous and worried about the safety of the family.
How might your reaction be if the person didn't have a disability?
Well, I think that's the question I ask myself all the time that kind of gets me out of, holds my values in check, because to be honest with you, you know, people without disabilities, it's just presumed that they're competent when it comes to raising children, and no one's asking them to prove whether or not they're capable of being good parents. And quite honestly, I've known probably a lot more people without disabilities who I felt like had kind of done a lousy job of raising their kids. So I think that for me, it's helpful to kind of to always say, like, question myself if my values are getting in the way, and say, geez, would I be feeling this way? Would I be thinking this way if the person didn't have a disability? So Karen, I have 2 questions for you. So when you think about these different values, I'm wondering if you can tell me, you know, how do you think that if someone does try to share these values, and especially negative ones, with people with disabilities, what kind of, you know, I mean, how can that have a negative impact on a person?
Well, if I have negative values, I may skip an important topic in conversations or discussions or training, like bisexuality or sexual orientation. Because my judgment may come through in my conversations. My facial expressions, like my mouth drops to the floor when somebody says they want to have a baby. I may get I may try to get them to stop a behavior, and that stops the conversation. I might even react by yelling or preaching, which would stop the conversation.
So we know how someone sharing their values can have a negative impact on a person with a disability. You know, share with me, what do you do, or what have you found helpful in situations where you feel like your values are kind of creeping into the conversation, or they're kind of getting in the way of you, you know, interacting with someone in a values neutral way?
Well, reflecting on these values and reflecting on why I feel judgmental about them would help. I might have to talk with colleagues or other allies. And most importantly, I may need to learn just to put my values aside. But it helps knowing what they are to be able to do that.
Okay. Alrighty, next slide, please.
Sexually healthy person knows their body parts, how they work, and how to take care of them. Knows that.
Oh, the next slide, please. It is. It is?
Knows,
oh, I'm so sorry.
knows that sexual feelings are healthy and normal. Knows the choices they have about what to do with the sexual feelings. Knows the different sexual behaviors and how they feel about them. knows about sexual pleasure and orgasm, knows which behaviors could cause pregnancy or getting a sexually transmitted infection, otherwise known as STI.
And Holly, if you can give us the next slide, that'd be great.
People with disabilities are sexual beings. Having a disability does not make you less attractive or desirable. For both people with and without disabilities, sex can be liberating, safe, and pleasurable. Self-advocates have made it clear that they are interested in knowing how to express their sexuality in safe and healthy ways. They want to have relationships of their own choosing, in their own time frame and shaped by our own values. Sex is not just intercourse, and your disability can make you more creative, in tune with your body as you explore your sexuality. Depending on your disability, sex may require more innovation, patience, and planning. And so it is important to listen to your body, talk to your parents, partners, and when relevant, your healthcare providers. Get all the information you need to protect yourself against sexually transmitted infections and unintended pregnancies. Sometimes disabilities may affect the type of birth control you use, so it's important to talk to an informed healthcare provider.
And the last comment I want to make regarding what it means to be a sexually healthy person is to comment that people with disabilities identify as GLBTQ within the same percentages or rate as it's found as people do in the general population. So next slide, please. Nicole, can you just share with us just kind of quickly the challenges that people face when trying to access reproductive and sexual health care?
The challenges that people face include communication difficulties, lack of preventative care and access to health promotion programs, inaccessible equipment, society's attitudes, social isolation and lack of transportation, poverty. Health professionals need more disability experience. Persons often are excluded from decision making, not knowing where to obtain information.
Next slide, please. So the solutions that we'd like to share with you are to help you assess and improve the healthcare delivery to people with disabilities. We really recommend that you establish partnerships with organizations of people with disabilities. And among the best way to raise awareness and build capacity in-house is always to include disability-related sessions and trainings all staff may be getting. Make the needs of people with disabilities a real integral part of the work that's done in your practice or in your office. We really find that separate programs are usually not necessary. We really want people to be included in their communities and using the generic resources within their communities. See that all of your sexual and reproductive health programs and practices also reach out and serve people with disabilities. Simple awareness can really go a long way. And when considering the care provided to your patients when it comes to their sexuality, their pregnancy intentions, their reproductive health needs, or sexual health, always question yourself and make sure that you are offering, question whether or not you're offering the same quality of care when a patient has a disability. You need to take a look at your facilities from the perspective of people with disabilities. This can work like considering adaptations like ramps or easy to understand graphics or language interpreters. Also, you might need to look at the kinds of equipment that you have in your facility. As you can see in the slide, there's a picture of the different kinds of examining tables that can be used, that can be accessible for people with disabilities. Be mindful of transportation needs and see if there are ways to facilitate access to places where sexual and reproductive rights information is available. And then just in general, we really want to really embrace people within the healthcare world to kind of, be allies and really promote awareness of disability in your community. And now Karen is going to share some examples of some resources that we've found that have been really helpful.
Next slide, please. This is a My Health booklet series. This was produced by Surrey Place Centre in Ontario. The purpose of this series is to offer guidance to people with developmental disabilities in a clear and simple manner. The series consists of 8 interactive booklets available online, and there's subjects such as a checkup or menopause, what is the big red dot, about having your period. There's 8 different booklets. It's interactive and it's written for people with developmental disabilities. Next slide, please. Here are 3 other sources that we found beneficial. The Ultimate Guide to Sex and Disability. The Beaded Necklace is a cool interactive site that concretely demonstrates the size of breast lumps. And the Sexuality and Developmental Disabilities curriculum was developed by Catherine McLaughlin and the Green Mountain Self-Advocates. This curriculum is unique in that it is taught by a self-advocate and an ally.
So we're going to spend the next few minutes talking about abuse in the lives of people with disabilities. Nicole? Next slide. Oh, you got it. Thank you.
Read that. Women and girls with developmental and/or mental health disabilities experience significantly higher rates of abuse in comparison to other disability groups. A 2011 review of the literature found lifetime rates that range from 50 to 90%. Half of these women have been assaulted more than 10 times. 30% of men with developmental disabilities have been sexually assaulted. Just 3% of sexual abuses involving people with developmental disabilities are ever reported. Women with a disability are far more likely to have a history of undesired sex with an intimate partner, 19.7% versus 8.2%.
Next slide, please. So as you can see, I mean, the research is kind of all over the place depending on how you define what kinds of sexual abuse you're looking at, what kinds of abuse you're looking at. But basically, for people with disabilities, they are 3 times more likely to be abused sometimes in their life. And with women and girls, as Nicole said, with developmental disabilities, the rate is even higher. I'd like to talk a little bit about, so people with disabilities experience the same kind of barriers to escaping sexual violence as everyone else in the general population, but there's also some other important, it's important for you to know some of the other barriers that that are really unique to people with disabilities. And so I'm going to go over those a little bit right now. So there's personal barriers, and then there's also kind of legal and social and cultural barriers. But the personal barriers are that people can be really fear of being institutionalized. In other words, that they try to leave the situation in which they're in and they're being abused, or they fear losing their independence, or that they might be sent to a nursing home. A lot of times people with disabilities, it might be the person that's actually providing personal care services to them, And so they're afraid if they try to end the violent situation that then they're going to lose their ability to kind of be able to exist in the, get services in the world. The abusers sometimes will damage or destroy equipment that people need to be able to escape. I heard of a terrible story where a young man who used an augmentative communication device to communicate, and he actually used his foot to communicate, and his abuser was burning his foot with cigarettes to keep him from communicating and telling people that he was being abused. So people with disabilities are experiencing much higher rates of physical and sexual abuse when they're children. So sometimes as a result of that, it's almost as if abusive behaviors become normalized. And as hard as it may be to understand this, they may not be identifying the abuse as being wrong or unacceptable. People are afraid their children are going to be taken away. They're afraid that they may not be able to take their service animals with them if they try to escape a situation. It's in the literature over and over again, it talks about how women and girls, especially with developmental disabilities, are really not believed when they report. So people are afraid that they will not be seen as credible. A lot of people have had some, negative experiences with the police or with doctors, and so they're reluctant to kind of contact systems. The people may not have transportation to be able to get out of a situation, and then overall, I think people just are afraid that when they do seek out to get help, that that the system will not, they'll lose their self-determination, and people will become very overprotective. Next slide, please. So just some of the other social barriers to think about are that a lot of times people, because they're not seen as sexual, then people are not seen as targets for sexual abuse. A lot of times people have fewer employment opportunities, so they're afraid if they try to escape an abusive situation that they'll lose a job that it took them years to find. I think finally also, I think that men are very less likely to report sexual abuse because of the additional stigma. And if people with disabilities are afraid that they're already seen as kind of helpless or in some way, not independent or not able to make their own decisions, they're afraid that if they report abuse that it'll kind of just reinforce these stereotypes. Next slide, please. So, Max.
So this slide and the next one is a sample script on how to respond when someone tells you they have been abused. And for now, I just will share with you some responses that we have found helpful. And I find it very helpful knowing what to say in this situation. So some of the things Jessica can say, we're just going to call her Jessica, it is okay to feel angry, scared, or any other feelings that come up. Don't be afraid to tell us what's going on. You do not need to feel ashamed. You are not alone. It is not your fault. This happens to other people. You don't deserve to be treated that way. You deserve respect and love. What are you most concerned about right now? What is most important to you right now? What have you done in the past to try to stay safe? How has it worked? This doesn't sound safe for you. There are people who work for the hotline who can help you with that. What is a safe person in your life, and can you talk to them about this? Next.
Yes, and Holly, we are at our 12:30 point where we are, I believe that you're going to facilitate us to see if anybody has any questions that they want to ask us.
Great. Thank you so much to the GMSA team for all that rich information. So just a reminder to all the participants on the webinar that you can go ahead and type any questions that you have into the question pane of your control panel. So the first question that we received is, do you have any tips for facilitating more confidential conversations with, for example, a youth when their parent or caregiver tends to accompany them to all of their appointments?
Oh, great question. I think that Max or Nicole, if you want to dive right in here and give your own personal experiences, have doctors or healthcare providers, how would they handle it? Have they always had your family in the room with you, or they have ever asked your family members to leave to talk to you privately?
Not unless I tell them to, or I'm comfortable. I guess it depends on, the subject. Usually I am comfortable with having my family in the room when a doctor so that I can understand what, the doctor is telling me, because sometimes I may not remember everything, or some of the medical language they may use may not be as accessible for me to understand, despite me asking questions for my family. But I think it's more of a team thing in that regard.
So I think, Max, you brought up just a really excellent point, and that is, if for some reason the healthcare provider does want to, offer the opportunity to have a private conversation with the youth with a disability, they're going to have to, as Max pointed out, they're going to have to really pay attention to the fact that they're going to have to make sure that the information they're sharing is accessible, and make sure the person has whatever they need to be able to remember any sort of suggestions or advice that they may get from the medical person, because the person, the family member might not, just to speak frankly, they may not just be there because they're trying to, they're concerned about their loved one, or maybe kind of, want to be, maybe controlling or being involved in the situation, but they also are there to make sure that there's follow through, and that the person knows what it is they need to do. Nicole, did you have anything you wanted to add, or are we good for that? You're good. Karen, did you want to add anything, or? Yeah.
There is a caution that we might want to put in here, in that sometimes if the parents refuse to leave, it can be a controlling situation where they're trying to cover up what's going on in the home, an abusive situation or whatever. So I would think it would be up to the medical professional to just lay down the law and say, I need to talk to this person alone.
I think also that I don't know how much we're going to go on, and I don't know how many other questions there are, Holly, but because this is such an important one. I think also, if people are working as a team, that it's really important for the person to start to learn how to be able to, interact with their healthcare provider on their own in some way, and to figure out what those accommodations are that they need to be able to take on, being able to be a healthy person and accessing the healthcare system, without their family there. So if, thinking of it as a training opportunity, or just as, a person may be transitioning from their pediatrician to general practitioners when they're going through this transition year. So it's a good time for people to start practicing being able to making their own appointments and being able to communicate with their doctor. And one thing I want to add is that on Monday we're going to be putting up some resources on our website, and some of those resources can be really helpful for a person with a disability to be able to independently go to the doctor and be able to communicate information. So, Holly?
Great. Okay, the next question is, do you know of any support groups for parenting with a disability?
Boy, we know of a lot of resources, but support groups, I am not familiar with them. But if the person who asked this question would be so willing to share their communication, you know, their email or something with us, we will be in touch with Susan Yuan, who lives here in Vermont, is really a national expert on this topic. And if it's not a peer group that they can attend in person, I do know that I've heard that there are some online kind of chat room kind of support groups that are out there. So Holly, we will be glad to track that down and get that information out for folks.
Excellent. Okay, the next question. You mentioned barrier to sexual health like lack of transportation. Currently, is GMSA facilitating social activities?
Go ahead.
Well, that's a very good question. I would say that whenever we have had sort of like, you know, health care groups that we've run, the transportation thing really is something that we pay attention to because it's a big barrier that a lot of people with disabilities face. I mean, we've gotten some, information about potential paths that the medical field, maybe like not just in the state but nationally, could go with appointments where somebody can come to a person's house, or maybe do it via internet, like video chat. We've gotten that, but I think that it just comes down to continuing to address the difficulties and then going from there, and really hearing it from peers themselves that are facing this.
So I just want to also add that in terms of social opportunities, Green Mountain Self-Advocates has 21 local self-advocacy groups located throughout the state, and those groups meet anywhere between 1 and 4 times a month. And although people come together to kind of learn things about advocacy and to speak up about, learn about disability rights, they also have a really big social component to belonging to those groups. So the person could be in touch with us, could call our office, and we can connect them with a local self-advocacy group. But also part of being a self-advocate, we try to support people, all of our peer advocates try to support people to how to be able to make connections in their community. We really would strongly suggest that people find out about, recreational or social activities, I'm so sorry, within their community, and that I'm having a hard time here. Anyways, we really promote people being included in their community, and really rather than setting up separate social activities, separate social opportunities, we would really try to support a person to kind of explore their community and make connections within their community. So Holly, I think I'm going to ask any other questions to kind of hold off so we can kind of get back to the 2 remaining topics that we want to talk about. Is that okay?
Sounds great.
Okay. All right. Where are we, Max? Okay. We are talking about, so our next big topic is, so how do you, we're looking on, can you switch to the next slide, please? Keep going. And one more. Okay, so Max and I are going to do a role play in a few minutes that we're going to demonstrate how you can support a person to be able to make their own decision, and how you can, we're going to demonstrate on how you can kind of give information to a person, at least I'm going to try, give information to a person where I'm remaining values neutral and I'm kind of keeping my opinions to myself. And so basically I'm going to run through the steps of what we're going to demonstrate, but there's basically about 5 steps that or tips that we're going to give people about how to answer questions when people come to you with questions about sexuality. And so step 1 is to really reassure the person that it's okay to ask questions. Can we go to the next slide? Step 2 is kind of to find out what the person really thinks or is really asking. A lot of times the first question that somebody asks you really is not what's on their mind, but they're kind of trying to scope out whether or not they can have a, what kind of a conversation they can have with you. But also, because if you just start to answer the question, the person may just be listening and they're not involved in the conversation. So we'll kind of demonstrate some different steps about how you can really kind of get the person to be involved in the conversation. And the next slide. And so step 3 is to really decide what kind of messages you want to give the person. Step 4 is to really answer simply and use correct vocabulary. And then step 5 is kind of find out if the person has any other questions to kind of get feedback from the person. So Max and I are gonna do this role play now, and all I can tell you is that we call this our hot potato activity. And think about it when, I don't know, I was born in the 50s, and we used to play hot potato activity when I was a little kid. We didn't have smartphones, and so we call it this because what I want to do is every time Max kind of throws a question into my lap, I think of it as a hot potato, and I kind of think about what is it I can say to kind of get the conversation back on him and get him to do more of the talking. So, all right, so are you ready, Max? All right, here we go.
Hey, Karen, how you doing?
I'm doing well,
I'm glad you're doing well. I could be better, but there's something that's been on my mind, and that it's been something that, like, I've been having some pretty awful disagreements with people.
Ooh.
Oh, just people just that I'm friends with. It's something that, it has to do with what they believe in, and it just seems like sometimes like they kind of think that I should be doing the same thing. But I've been talking to some of them about sex lately, and one of the things that they've said is, it would be best if you would wait until you get married, until you have sexual intercourse. And I'm just wondering, what do you have to say about that?
Whoa, well, I mean, the first thing I want to say is, Max, I kind of feel honored that you trust me enough and that you have come to me to talk to me about this. And so thanks for bringing up the topic. And, anytime you want to talk about this, is certainly, let's make sure we can, carve out time to talk about this topic. So I guess my first question to you is well, what do you think?
I don't know. I mean, I kind of like getting some input from people who, kind of probably have been following this topic better than me. That's why I'm coming to you. I mean, I'm just saying.
Yeah.
A little bit. I don't know what I think. I kind of haven't thought that yet.
Yeah.
A lot of what I get is from other people, but I'm
Right.
just saying, people that actually know their, stuff a little bit around this.
Well, Max, I think you really do know your stuff around this. And I heard you say that you've been hearing some opinions about people that are saying that you have to wait until you get married before you have sex. But have you heard any other opinions? Or do you have any other opinions that you've thought about?
Well, in order for me to have good opinions, is I usually educate myself around some other people's opinions, such as people that may, I don't know, may have differently. I just know that you've talked to many people about this, so I'm just asking what you think of the whole concept of having sex until you're married, not having sex until you're married.
Really seems like you really want me to tell you what to do here, Max, and I got to be honest with you, I just don't feel comfortable like that. I want to kind of figure out what kind of, what information do you need to be able, it's really a personal decision, Max, and you are a really bright guy, and I think that you are, going to be able to make this decision for yourself. I mean, have you thought about what do you think you need to know before you, what kind of information do you need, or what do you think you need to know about before you would decide to have sex, whether you did it before or after you got married?
Anything that you could come up with. That's how I learn.
Okay, we're gonna stop the role play right now because Max will not let me off the hook here. Thank you, Max. I just want to kind of demonstrate about how I hope you can see the kind of hot potato where I kept trying to put the conversation back into his lap, and I would be willing to give him all kinds of information and even kind of, paint some different options or scenarios, but I'm really not going to tell him what to do. So I want to finish up this section of the webinar to just say, please, I'm going to go through, there are different kinds of questions that people ask you. So if I can have the next slide, Holly. Okay, so the one type of question that people are going to ask you is kind of information questions. So this is one about what is an erection, or somebody might use slang word for that. And what we're doing is, I'm not going to review all of this, but what we've provided for you in the next 4 or 5 slides is we've given you an example of a kind of question that someone would ask, and then we're just kind of giving you an example of what you could say. So the next slide, please. So another big question that people might ask you is how babies are made. And so, again, we're giving you a suggestion of something you could say to give them the information. But then you would always end the question and your comment by asking the person, what else, what other questions do you have about babies? So in addition to information questions, if we can have the next slide, people will ask you questions about how do you do stuff. And so, so people will ask you questions of not only what is sex, but how do people have sex? So there's a simple answer for you as how you can answer that question. And the next slide is a question that people have asked me numerous times, and maybe I've even asked myself, how do I know if I'm in love? So again, so just to give you an example, we just would very simply say, this can be really hard to tell. Usually relationships start out with attraction and grow into love. People say that love is deeper than just thinking someone is attractive or hot. So I mean, just giving you an example of kind of a straightforward way that you could answer that question. The next slide, please. Okay, so this is where Max was at. He was asking, he was giving me the question, what do you think questions? And what do you think questions are where you can really, as someone who is a healthcare provider, can kind of get into the where you're at risk of sharing your values or sharing your opinions with the person. And we really feel like people's values need to come from their family, from their parents, but that if you're a healthcare professional, you really need to be keeping, it's not appropriate for you to share your values with the person. So, and that really our role is to help a person figure out what they think by asking questions or giving them some information. So anyways, thank you very much for listening to our comments on that. And now I'm going to turn it over to Karen Noon. Holly, unfortunately, we're running a little bit low on time, but I do want Karen Noon to say a few comments about parents with disabilities. Sorry, we talked too long.
Parenting with disabilities, Nicole has a comment to make.
Research studies have suggested that the presence of a parental physical disability has no negative impact on child development in that the challenges are similar to families without disabilities. So you may be wondering why we included a picture of Michelle Obama. She grew up with a father who had a disability. I think we can all agree she's a rock star and doing well.
Next slide, please.
Here are some statistics on parenting with a disability. I won't read them all, but I will point out that 1 in 10 children have a parent with a disability. And many states still look at disability as the sole reason to remove a child from the family. Next slide, please. Research has shown that there is not an impact on the children, but women with disabilities still deal with the stereotypes of being vulnerable, asexual, infertile, and incapable of being mothers. Next slide, please. I'm going fast here. There are other additional barriers to people becoming parents. There's significant discrimination in the assisted reproduction technology. Parents are discriminated against in the adoption process. ADA forbids this, but some state laws still have exclusionary language. Birth parents may discriminate against parents with a disability adopting the child. Referrals to the child welfare system is disproportionately high. 35 states include disability alone as grounds to terminate parental rights. Assisted parenting or parenting support is not covered by Medicare or Medicaid, and this means that parents may need to pay for the support out of pocket or rely on unpaid help from family and friends. Next slide, please.
Go to the next one.
No.
Holly, can we go to the next slide? There we go.
Next. Research has found that with assistance from others, adaptations, parenting education in accessible format, and well-coordinated peer support, people with disabilities can be effective parents.
Holly, I want to just do a quick time check here. Do we want to stop at 12:55 for more questions? Or since we took like 10 minutes of questions, should we just...
Yeah, why don't you guys just go ahead and continue with the presentation? And folks, if you have questions as they're coming up, don't hesitate to type them in. And, we can kind of stop you guys at a point when we have a few questions lined up and let you know. I did want to mention, too, one thing that we forgot to explain. So there's a handout pane in your control panel, and you'll see that I believe there's 5 documents uploaded, or I'm sorry, there's only 1 document uploaded into that handout pane, and that's the slides for today's presentation. So we'll keep, even after we run out of time, we'll keep the webinar open so you can click on that, download it, save it on your own desktop, and really look at these materials more closely at your leisure. So yeah, go ahead and we'll let the questions accumulate and take them at the end.
So next slide, please.
Deaf mothers deal with some unique challenges. They have said the discrimination they incur is more disabling than their hearing loss or deafness. There is a bias that hearing children will not learn developmentally typical language skills. Research shows that learning American Sign Language develops the language skills. Professionals communicate with the hearing child using the child as an interpreter instead of an ASL interpreter. Undermines the importance of the parental role.
For parents with mental health issues, next slide, please. For parents with mental health issues, there are assumptions that children will suffer. Mothers needlessly stop taking medications for fear of harming the pregnancy. Mothers feel constantly scrutinized. Children are removed from custody at the highest rate. So what can we do? Teach effective parenting strategies, use culturally appropriate assessments of parenting skills, support and develop programs that use interdisciplinary care approaches and interprofessional collaboration. Parents with intellectual disabilities have historically been forced with sterilization.
The next slide, please. Thank you.
Next slide, please. And they are forced to have their children removed. IQ score is used to determine parental capacity. Most support is short-term and should be ongoing because children change as they grow. So what can we do? We can provide social support, expand parent support networks, as the person was saying, focus on warmth and positive interactions in the family. In-home training is the best, and it improves, should be focusing on improving decision-making, problem-solving, and planning. Modeling and feedback are good teaching strategies, and we also know that lots of repetition helps with folks with developmental disabilities. Next slide, please.
So what can we do to help parents with physical and sensory disabilities? Aside from the obvious of society becoming less biased or prejudiced, we can facilitate emotional support for peers, extended family, and outsiders, support efforts to lift parents out of poverty, isolation, parenting alone, and family conflicts, advocate for funding for home modifications, accessible transportation, and community accessibility.
Next slide, please. Here are some resources that we found that are excellent with the, working with disabled parents, and we also put up our website, gmsabt.org, where you can find a link to all of the information.
So we're going to turn it quickly to Nicole and Max and just see if they have any kind of closing statements.
And one final thing to add on the subject is it's important that when working with teenagers and youth, that puberty isn't a surprise, especially when we look nowadays, like puberty is coming earlier, studies show, like, due to, American diet, starting at like 9, 10 years old. It's surprises like that are not fun.
And is that, did you want to share with that?
Based on personal experience, those are the surprises people don't like.
What happened for you, Nicole? You just didn't know about your period? Is that what it was?
Yeah, because it came, in my case, it came when I was 10 years old.
Uh-huh.
And, back then, that was 90s, like, and it just wasn't a subject that was, discussed.
Right.
And when you look at the schools here, when they do the whole, videos that they show you on, they don't do that to you, like, towards the end of, like, 6th grade.
Mm-hmm.
6th grade.
So it was a surprise for you.
Yeah, it's a little too late.
Yeah. Max, what about you? Do you have any final parting statements you want to make for people?
Family members, and talking to your parents or your family about sex can be difficult. And I totally get that every family is different. But for me, I think if there's any challenge of me, I'm actually fortunate to have parents that are very supportive of, me and my sexual health. And I think, for me, it's not like they know that I can, make good decisions based off their support. So it's kind of like supported decision making. They give me good education of what to do to move forward on my life when it comes to sexual health. But, I, would encourage, families to be more open, but really, like, be more open to what, your sons or daughters really, where they want to go when it comes to taking care of themselves.
Thank you very much, Holly, from Green Mountain Self Advocates.
Great. Well, thank you guys so much for a really wonderful presentation today. We did have two sort of more in the realm of comments come in, and I'm just going to try to paraphrase in the interest of time. There was a participant who wanted to share that there is a agency of education is planning to host a training on sexual health education for people with disabilities. This would be for teachers and para-educators and will likely be in the fall. And he let us know that, I'll follow up with more information. So that might be an opportunity that some folks on the webinar will be interested in hearing more about. There was also a question about where to find the recordings from the 2 webinars that we've had before today's webinar. So we do have a website. It's unfortunately not on this slide, but if you were to Google the Vermont Healthcare Innovation Project, the website would pop right up, and there is a link to the core competency training in there. Not everything is up to date yet, but we're working on getting materials posted as we go along. So that's where everything will live, hopefully in the near future. And then finally, I did just want to give a quick plug for our next webinar. So we're going to be holding another webinar in just a couple of weeks. The topic for that webinar is called Radical Accompaniment, Tools and Frameworks for Walking with Our Complex Clients. So please be looking for that registration link. It's going to be coming very soon, given that this webinar is only a couple weeks away. And finally, we have a few spots left in the repeat of the 3-day fundamental training delivered by PCDC, the Primary Care Development Corporation, and that's at the Cherry Street venue in Burlington, August 17th, 18th, and 19th. You can see the registration link here, which has a lot more information on the topics associated with each of those 3 days. This is the kind of Burlington Section 2 training date, but it's a good opportunity if you were to have missed a day or know somebody who just didn't attend the first time around. There are still a few spots left, and you can email Holly Stone at partner.vermont.gov if you have any more specific questions. And finally, we just wanted to thank everyone for your time today and wish you all an enjoyable day going forward. Thanks so much.